Very good afternoon. Thanks for joining us here on The Big Story. I'm Afrida Rahman Ali. Covishield maker Serum Institute of India has now urged the government of India to fast-track the vaccine movement, citing difficulties faced in production and cold chain space planning. The institute has recently told the centre that there is a stock of over 24 crores of vaccine and it is going up by the day, adding to these difficulties. Remember, the centre has allowed the Serum Institute to export 50 lakh doses of Covishield to Nepal, Tajikistan, Mozambique and Bangladesh. But due to the rising stock issues, the institute has now sought urgent government intervention to ensure smooth flow of the vaccines, both for domestic and international use. The question that we are asking here on The Big Story is, number one, why is the government of India not considering introducing the booster dose if that is the kind of stock lying which is occupying cold storage space? Serum Institute's bone of contention is they need to clear out that space because the production has increased, but there is no cold storage available because of the stockpiling. What this essentially means also is that there could be a colossal waste of vaccines. So clearly, viewers, the tables have turned. Today, the demand-supply equation has, to a certain extent, reversed. We're talking about a problem of plenty. And that's the question I want to address with our experts this afternoon. Joining us this afternoon on Mirror Now, Dr. Rajiv Jayadevan, who is a scientific advisor in the Indian Medical Association. Good afternoon, Dr. Jayadevan, and a pleasure to have you with us here on The Big Story. The question that I'm trying to address and trying to also understand is, what are the compulsions really? Is it cast in stone that you have to cover your adult population, cover double dose? Only then can you introduce a booster dose, because here we have a situation where we have stocks lying unused. Do you consider this a problem at this stage for this country?
We need to vaccinate as many adults as possible before the next wave hits India. India has given out 1.2 billion doses, but it also means that India has 20% of its adults not having received even a single dose. And 20% may not sound like much, but I'll give you the numbers. It's 180 million people. That is more than three times the population of England. Now, we need to get the vaccine out, 2 doses to all of these individuals. Okay. And also, we need to complete the second dose for all those who just received 1 dose. There are some people who are reluctant to come forward for the second dose. They must immediately come forward for the second dose. India is in a quiet phase of the pandemic right now, but it's not going to remain quiet for long. This is the best time to get the vaccine out to the people so that when the next wave comes, we will have much less deaths than would otherwise happen.
That's a very important point. So what I gather from what you said is that let's put the booster dose issue on hold till we cover bulk of the adult population, and we haven't really even covered 50% of the adult population have not yet got both the doses. So what Dr. Jayadevan here is emphasizing on is let's get that going first. Clearly, a certain amount of complacency has set in. I would also like to welcome Dr. Anita Ramesh, clinical trial specialist and senior consultant from the Apollo Hospitals in Chennai. Thank you so much, Dr. Anita Ramesh, for joining us. Dr. Ramesh, do you concede that today we are facing a problem of plenty? There are unused vaccines lying with the cold storage. Serum Institute is now raising the alarm that we need that space to clear out because their production has increased multifold and the space is occupied by unused vaccines. With a problem like this, what do you suggest should be the way forward? Should the government of India take better initiatives to reach those areas, those pockets with unvaccinated population, or do you think a booster dose may be a good idea to actually use up? At least we can avoid a colossal waste.
Yes, you are right. I agree with you. Both should run simultaneously. Yes, like take for me, I'm a clinician. I finished my second dose back in February. I am almost 9 months not vaccinated with a waning in the immunity level. Yes, at least for the high priority, which includes healthcare workers, any level, everybody, including the immunocompromised and organ deficient people like heart, cardiac, should be vaccinated at utmost with the booster. And you have so much of vaccine, and they're all willing to come. At the same time, don't stop pure vaccination, which is going on, and the government should take more initiative. Like in Tamil Nadu, now we have started door-to-door vaccination. So all over the India, the government should do that. We have extra vaccine, and remember, the cold chain is very, very important, and we cannot afford to lose those vaccines. So door-to-door initiative in every corner of India to vaccinate at least one dose to the entire population. That should not stop, should go parallelly. And this is very important. All over the world, people are giving booster dose or additional dose, and India should start immediately, because the main chunk, the healthcare professionals and the immunocompromised are open. Now, again, the wave may rise. You heard the other doctor telling, don't think that it will be for a long time. It may come back. So my priority is booster dose, and many countries have already adopted, and India should immediately start. Having said that, because you have so many vaccines with you left over.
Yes, so what should be the priority then? Dr. Rajiv Jayadevan, should the priority be to use up the vaccines for those whose immunity might actually be waning? Like you heard Dr. Anita Ramesh saying, those ones who got the jabs very early in this entire process, are they now as good as unvaccinated? Are they still, protected? That remains a question. And if that is the case, and let me also remind you and our viewers here that all those countries that have introduced the booster dose, it's not like they have finished with covering their entire population. Even those countries are doing it simultaneously, which is why, Dr. Jayadevan, I want you to explain to us why you feel we still should focus now on covering both the doses rather than going into the booster dose.
For our viewers, it's important for them to know that when we use terms like waning of immunity, it does not mean that the vaccine is becoming useless. Vaccines protect on two fronts. They protect from infection and spreading the virus. That's a short-term protection. And they protect from severe disease and death. That is long-term protection, which is expected to run for several years, because that's based on a separate arm of immunity. Okay. But what a booster will do is to temporarily increase your antibody levels. So it will give you a temporary umbrella. It's almost like an umbrella that will vanish in a few months' time. But if you're facing a surge, the Western nations are facing a winter surge, and it is a holiday season when people almost exclusively gather for festivities indoors with family. And they are facing a massive surge right now all across Europe and also in the US. So it is their need that they need to do everything possible to reduce the spread of the infection. India, as I mentioned, is in the quiet phase now, and it is our priority to reduce deaths to the extent possible. So remember, the most important priority in a pandemic is to reduce deaths, which means that we should reach out to all the elderly, especially people over 40, because over 97% of our deaths have occurred over the age of 40. We must focus on that segment, get the vaccine out to everyone. And as Dr. Anita said, there are some vulnerable people, for example, immunosuppressed people. Now, their immunity does not wane. It is just that 2 doses are not enough for them to generate a response. Their immunity does not wane. For such individuals, yes, a 3rd dose is needed. And for a doctor who is facing a lot of viral load and who's older and who has other associated conditions and is at risk of severe disease, yes, such individuals also should get priority when booster doses are rolled out.
Yes, so clearly we have both sides of the argument here, and it's interesting to have this kind of a conversation where we get to know the entire perspective. But the reality is the numbers are receding in India when it comes to the COVID cases. In fact, I would like to point out that after celebrating 2 big festivals like Diwali and Durga Puja in October and November, the infections have fallen to multi-month lows now. So, like you said, yes, the compulsions in Western countries may be different. They may be, well advised to introduce the booster. We are in a slightly different situation. Dr. Anita Ramesh?
Yes, we just to take it, we might have entered into what is called endemic. Okay, endemic means that there is spread of infection in a localized area. We have come out of the pandemic for a temporary thing, whereas the pandemic continues in European countries, US, and even the Eastern countries. So that endemic situation might be due to herd immunity, might be due to awareness and population and government interference with the COVID protection and management. Also, it is because of the vaccine. And all things put together, herd immunity, all these things might have brought India into an endemic. And that is the first country in the world we have entered the endemic as on today. So yes, when we have entered into the endemic, it doesn't mean we cannot go into the pandemic. To prevent us from going into Yes, in all lines we have to work. We need to vaccinate the entire population, complete it, and as well as start the booster and the additional dose. Remember, I want to tell you two things. This word additional and booster is two different words. We give booster to healthcare professional who are exposed to high loads of the virus, you heard our doctor tell, and additional dose is to an immunocompromised individual, because for them that two dose. See, I'm a cancer specialist. I treat cancer patients. Most of my patients are immunocompromised. They will need an additional dose. So additional dose in an immunocompromised to boost up immunity, and to healthcare and high-risk individuals, and a booster is needed to again keep them going, because the virus is still there with us and we are living the virus and we are fighting. And I agree with all of you, and I agree with all what are the things happening. Yes, simultaneously booster vaccination or additional dose has to pile up. We should not allow the vaccine to waste.
Yes.
Plus, it should continue as its own vaccination protocol, which is getting into door-to-door vaccination, more awareness, more TV programs, more sensitization, and making vaccine as a passport for everything. Whatever you do, you need a double dose or at least a single dose with a negative RT-PCR before you maybe walk into a mall or walk into a flight or anything. That will help us to go.
Yes, that's a very important distinction you made between additional and booster. So a lot of times it would be the prerogative of the medical practitioner, I believe, to diagnose a situation accordingly and perhaps prescribe an additional dose for an immunocompromised person. There seems to be at least some laxity at this point in terms of pushing the vaccination process. The aggressiveness has come down, because of which now the motivation within the people also has come down. That has declined, and therefore we must remember that we cannot afford to do that. The process of vaccination must pace up. Once again, both our experts believe in that. Thank you so much, Dr. Jayadevan and Dr. Anita Ramesh, for joining us this afternoon. Let's take a quick break here. News and updates continue on the other side. Stay with Prerna.